The video you are about to watch outlines DMC's COVID-19 safety protocol for in-office visits until further notice. Adherence to all elements of this protocol is mandatory in order to keep you and our patients safe and to prevent the spread of infection. Medical Assistant Workflow Protocol. MAs are required to wear a surgical mask, goggles, and gloves at all times when in direct contact with patient. When you arrive on your shift, don gloves and cavi wipe your ID badge. Then, dispose of gloves, use hand sanitizer, don new gloves, and remove your cloth mask. Fold the cloth mask with the outside facing in and place in a plastic bag. You can then put on your mask, goggles, and gloves. MAs have to ensure that the patient and anyone accompanying the patient keeps their mask on, covering the nose and mouth at all times. MAs can use cavi wipes to clean the laptop before and after bringing it to the exam room. Hand washing or use of hand sanitizer is a must before wearing the gloves. When retrieving the patient from the waiting room, it is the MA's responsibility to open the door between waiting room and the clinic to call the patient and escort them to an exam room. Sanitize the gloves with sanitizer after entering the exam room. Take vital signs, temp, BP, and pulse ox. Take blood sample for any POC testing, A1C, blood glucose, ISTAT. Then, leave it in the assigned sanitized tray on the countertop. Remove gloves, wash hands, and then document in the EMR. MAs must ask patient for their height and weight, which is then documented as patient self-reported. Some patients may require weight or height checks. Provider will inform MA if weight or height is required, in which case weighing scale and or height meter stadiometer must be cleaned with the cavi wipe. MAs must update history and other pertinent information in EMR while observing social distance from patient and before touching the patient. If POC specimen is collected, then wear gloves and bring it to the testing station. When re-entering exam room for administration of vaccine, etc., wear gloves again and discard after administration but before leaving the room. At the end of the visit, it is the MA's responsibility to escort the patient out through the exit door by opening all the doors. Hand washing or use of hand sanitizer is mandatory after opening any doors and getting ready to bring the next patient in. Exam room setting and cleaning protocol. Exam table paper roll must be removed. Pillows must be removed. Plastic pillows available if needed during an exam must be used without paper covers. Cavi wipe before and after use. Brochures, flyers, paper, documents, and bulletin boards must be removed. Screen the exam room to make sure none of these items have made their way into the room. Discard them immediately if found. Avoid bringing anything in or out of the exam room, including pens or medical supplies. Personal work laptops may be cavi wiped at the beginning and end of each day and throughout the day as indicated. Minimize opening drawers or cabinets while patient is in the exam room by collecting needed supplies and place on the counter prior to bringing the patient into the room. Gloves must be discarded properly in the trash before leaving the exam room. After patient visit, medical assistant will wash hands, then disinfect all equipment on the wall panels and all surfaces, countertops, chair, exam table, with cavi wipes twice or disinfectant spray. Anything wiped or sprayed must be permitted to air dry. If EKG machine is brought into the room, electrode patch will be discarded immediately after use. Cables and machine must be cavi wiped thoroughly. BP cuffs and stethoscope must be cavi wiped thoroughly. Hands must be washed thoroughly after cleaning exam room. Protocol for restroom use. Advise patient to inform the MA if they intend to use the restroom. Remind patient to wash their hands after use of the restroom. Witness use of hand sanitizer after coming out of the restroom. MA will wash hands, don gloves, flush the toilet again, and wipe off sink and toilet seat with Cavi wipe. Use Cavi wipe on the faucet and doorknob as well. Wash hands thoroughly after restroom is cleaned.